Movement as medicine. Scientific relief for arthritis in seniors. Current scientific evidence demonstrates that specific movements and exercise-based therapies are among the most effective interventions for relieving joint pain in older adults, with proven benefits that surpass many traditional pharmacological approaches. Understanding the magnitude of the problem arthritis affects approximately 48% of all adults aged 65 or older, rising to 53.9% in those 75 and over in the United States. Globally, over 595 million people live with osteoarthritis, a 132.2% increase since 1990. In Brazil, studies in Rio Grande do Sul show a prevalence of 43.1% in adults aged 60 and over, with 50% of women and less than 30% of men affected. The impact extends beyond numbers. 25.7 million American adults have activity limitations attributable to arthritis, and 44% of people with arthritis report significant limitations in daily activities. The annual economic cost exceeds $300 billion in the United States alone, considering medical expenses and lost productivity. Mechanisms of joint pain. What happens in your joints? To understand how movement works as medicine, it's essential to grasp what causes joint pain. Osteoarthritis, the most common type in older adults, occurs when cartilage, the smooth tissue lining the joints, wears down faster than the body can repair it. Imagine cartilage as a car's shock absorber. When it wears out, bones begin to rub directly against each other, causing pain and stiffness. Rheumatoid arthritis is different. It's an autoimmune disease where the immune system mistakenly attacks its own joints. It's like having friendly soldiers turn against their own army, causing persistent inflammation and intense pain. With aging, significant cellular changes occur. Cartilage cells, chondrocytes, become senescent, producing less repair material and more inflammatory substances. There is also an accumulation of advanced glycation end products, AGs, that harden tissues, and a reduction in cell density that compromises regenerative capacity. The pain mechanism involves specialized receptors, nociceptors, that detect pressure, heat, and inflammatory chemicals. With chronic inflammation, these receptors become hypersensitive, like an alarm system that triggers with increasingly smaller stimuli. This explains why even gentle movements can cause pain disproportionate to the actual damage. The science behind movement as medicine. Recent meta-analyses, 2022-2025, show that structured exercises reduce pain by 10-15 points on a 0-100 scale and improve physical function by 10-15 points on disability measures. A 2025 study in the Journal of Medical Internet Research, analyzing 9 clinical trials with 1,604 patients, showed that digital exercise therapies significantly reduced pain scores and improved physical function. Exercise works through multiple biomolecular mechanisms. Inflammation modulation. Exercise reduces pro-inflammatory cytokines like TNF-A, IL-1V, and IL-6, while increasing anti-inflammatory mediators. Studies show a 9.9% reduction in IL-8 after 12 months of physical activity. Neuroplasticity. Exercise promotes adaptive changes in the brain, increasing cortical and hippocampal volume and enhancing neural connectivity. This is particularly important for seniors as it combats age-related neurodegeneration. Joint lubrication. Movement stimulates the production of synovial fluid, which nourishes cartilage and reduces friction. It's like applying oil to rusty hinges. Regular movement keeps the joints lubricated. The secret moves. Specific exercises with proven efficacy. Based on evidence from the American College of Rheumatology, European League Against Rheumatism, and Osteoarthritis Research Society International Guidelines, these are the most effective movements. Range of motion, ROM, exercises. For knees, heel slides, Lying down, slide your heel toward your glutes and slowly return. Hold for 5-10 seconds, repeat 10-15 times. Quad sets, seated, straighten your leg and hold for 10-20 seconds, focusing on the front thigh muscle. For hips, hip cars, controlled articular rotations, controlled circular movements that mobilize synovial fluid and maintain full range of motion. Side leg raises, standing, lift your leg to the side while maintaining balance, strengthening, stabilizing muscles. For shoulders, arm circles, progressive circular movements, starting small and gradually increasing the range. Cross-body stretches, pull one arm across your body holding for 15 to 30 seconds. Progressive strengthening, evidence-based protocol. Frequency, 2 to 3 times per week with 48 hours of rest between sessions. Intensity, start with body weight, progressing to light resistance. Progression, increase duration or intensity by 10% weekly. Fundamental exercises, sit to stands, strengthens quads, glutes and core muscles functionally. Straight leg raises, strengthens quads without bending the knee. Glute bridges, activates hamstrings and glutes. Wall push-ups, safely strengthens arms and shoulders. Low-impact activities, aquatic exercises. A Cochrane review of 13 studies with 1,190 participants showed moderate quality evidence for small but clinically relevant effects on pain, disability, and quality of life. Buoyancy reduces body weight by 50% at waist depth and 90% at neck depth. Tai Chi. Multiple systematic reviews show efficacy for knee osteoarthritis pain, balance, and function. Programs last 12-16 weeks, 2-3 times per week, with a recommended home practice of 30 minutes, 4+ days a week. Modified yoga. Studies show that yoga is non-inferior to strengthening exercises for knee osteoarthritis. Exercise prescription. FitVP principles for seniors. Frequency. Aerobic, 5 to 7 days per week. Strengthening, 2-3 non-consecutive days per week. Flexibility, daily. Balance, 2 to 3 days per week. Intensity. Aerobic, moderate intensity, 40-60% of heart rate reserve. Strengthening, 60-80% of 1 RM, gradual progression. Flexibility, to the point of mild tension, not pain. Time. Aerobic, 150 moderate minutes or 75 vigorous minutes per week. Strengthening, 8-12 repetitions, 2 to 3. Sets. Flexibility, hold stretches for 15 to 30 seconds. Type, low-impact aerobic activities, progressive resistance training, dynamic and static stretches, multidirectional balance challenges, safety and contraindications. Absolute contraindications: acute joint inflammation, infection, uncontrolled cardiovascular disease, severe osteoporosis with fracture risk, severe joint deformity limiting safe movement. Warning signs: stop exercising, sudden sharp pain, significant joint swelling, dizziness or shortness of breath, persistent increase in pain, 2 hours post-exercise, multidisciplinary approach, when to seek specialized help, urgent referral to a rheumatologist within 2 weeks, suspected inflammatory arthritis with joint swelling, morning stiffness, 30 minutes, rapid onset of symptoms, elevated inflammatory markers, ESR, CRP. Physical therapy is essential for a personalized exercise program, manual therapy techniques, pain control modalities, gait training and assistive devices. Occupational therapy helps with joint protection, adaptive devices, energy conservation, home environment modifications. Recent innovations, 2022-2025. Precision medicine. Research shows that blood biomarkers combined with neuroimaging can predict response to exercise interventions, allowing for personalized prescriptions. Hatha yoga programs of 8 to 12 weeks improve physical function, reduce anxiety, and enhance sleep quality. Wearable technology. Invisible wireless sensors continuously monitor movement, providing real-time biofeedback and adaptive exercise recommendations. Virtual reality. Systematic reviews from 2023-2024 show the effectiveness of VR for motivation and adherence, particularly beneficial for balance and functional mobility training. Expected outcomes and timeline. Timeline of benefits. Pain relief, 2-4 weeks. Strength gains, 4 to 6 weeks. Functional improvement, 6 to 8 weeks. Quality of life, 8-12 weeks. Quantifiable improvements. Pain reduction, 10 to 15 points on a 0-100 scale. Function improvement, 10-15 points on disability measures. Strength gains, 15 to 25% improvement in 8 to 12 weeks. Balance, reduce fall risk and greater confidence. Conclusion, movement as personalized medicine. The current scientific evidence is unequivocal. Specific, structured movement represents one of the most powerful interventions for arthritis in older adults. Unlike medications that merely mask symptoms, exercise addresses the root causes of joint pain by promoting tissue repair, reducing inflammation, and improving neurological function. The future of rheumatological medicine is moving toward precision medicine approaches that combine deep phenotyping, real-time monitoring, and adaptive interventions. However, the fundamental principles remain: regular movement, gradual progression, and a multidisciplinary approach. For you as a patient, this means the most effective medicine for your arthritis is not necessarily in a pharmacy, but in your daily movement. Start slowly, be consistent, and work with a team of qualified healthcare professionals. Research shows that patients who engage in structured exercise programs experience not only pain relief, but also significant improvements in physical function, mood, and independence. Movement is truly your medicine. Use it wisely, and it will transform not just your joints, but your overall quality of life. In an era of increasing life expectancy, maintaining joint mobility and function through movement is an essential investment in your future health and well-being.